Okay, so just wanted to make a quick video about my trip to hospital in the last 5 weeks. This is my third attempt at making a video. First time my phone kept ringing, and the second time my phone kept ringing. So third time, here we go. So if on a scale of 1 to 10, how do I feel it went? With 10 being that I felt all my needs were met and all the issues I wanted to talk about were talked about. Like if that's a 10 and a 0 is I shouldn't have went at all, I would give it a 6, 6.5, 6.5, which is kind of sad, but at the same time, it's still a 6.5. So, in my opinion, it was worthwhile, and I'm glad I went. Um, my whole goal of going to hospital was to talk to um, go back and revisit some things that had been brought up in therapy the last time I was there. The last time I was there, I went in for um, what I thought was bipolar and mental illnesses, which I believe was the case, but I had huge addictions at the time, especially alcohol. I was massively addicted to alcohol. I was abusing alcohol. I was doing drugs as well, but I was abusing alcohol at a very serious level at that point in my life. So I did an addiction program, and I also did talking therapy. And in that talking therapy, some issues came up, and I left hospital before they were fully addressed. So with this trip, I really wanted to go and pick up where I left off and address those issues. That didn't happen at all. So that's a huge blow to my benefits of going to hospital. I remember I sat with my doctor in the hospital, and he asked me what is it I wanted from what was it I wanted from my stay in the hospital, and I talked about how I wanted to address those issues with a specific therapist who worked within that hospital, the same woman, and I wanted to pick up from where I left off. I just want to check something real quick. Yeah, I'm sorry if the glow is very kind of reddish hue. It's the lighting isn't very good in the room. But anyway, um, what happened was that therapist wasn't there for a lot of the time I was in hospital. She was on summer holidays. My first week was, and which kind of happens, I think, in hospitals, is usually just a settling down period and coming to grips with where you are, getting a feel for the place, doing one or two lectures, getting to know a few people, and just finding your feet. So that's kind of week one gone. And I actually enjoyed week one. I got to meet some nice people who became good friends of mine when I was there. So then I also was battling the stigma attached with addiction. When I told my doctor that I was had been using cocaine and alcohol and Valium um, prior to coming in, I was very afraid that he was going to see me just as an addict. So I had to hopefully um, make him hear me that this hospitalization was not like my last one. This time I'm focusing on the issues behind the addiction. I want to address them. I want to know why, if I get 8 months sobriety, do I explosively go back on drinking drugs, like very high levels of everything. So I felt that this hospitalization, those things were at the forefront and not my addictions. It took a while, but luckily he kind of heard me, and I felt heard, which was very important to me. To the point where if I didn't, I was going to leave. I actually, some friends of mine were very worried that I was going to just walk out of the hospital, and I was, because I wasn't there for addiction, and I felt if I wasn't heard on this matter, that I was just going to be seen as an addict and not get the help that was needed for me. So anyway, kind of week one went on. Week two, that therapist, she was away. I seen her at one psychotherapy group, and I'll speak about psychotherapy group later. They're very powerful and they're very good. So she went away for 2 weeks. So in the 5 weeks that I was in hospital, I got to see her twice. Once for 45 minutes, and the following week for 45 minutes. My hope when I went into the hospital was to see her maybe 3 or 4 times a week and really, really hash it out, my issues, and talk about them, and cry with her, and explore all my emotions, and really to hopefully put the lid back on and say that's talked about and it's dealt with now. None of that happened whatsoever. And while she was away, the doctor basically said, okay, in the meantime, go to a few lectures, do a few groups, and wait till she gets back. And I had to say to him, can we not just please try some medication? Experiment with me. Like I really felt that, because I had never been on medication in my life, and I really felt that I needed something. I needed something to just help me along in life, and I was put on Lyrica, and I feel that they're very, very beneficial to me. What they do for me is, I find that my anxiety prior to going to hospital was always at around 4 out of 10, 3.5, 4 out of 10. And when it spiked, like that's on a day-to-day normal existence. And when the anxiety rose, it would go from 4 to 7, 8, 9, sometimes 10, and then drop back down, depending on where I am or what situation I'm in. Lyrica reduces that, so my base level is probably 2.5 to 3.5 on my scales. It's 2.5 to 3.5 due to Lyrica, and the benefits of that is I feel that when I'm at 3.5 or 4 out of 10, that my thoughts are very panicky because of my anxiety levels. My thoughts are panicky, and I might think thoughts that aren't clear, or they're very like borderline paranoid, or just worried, but very panicked thoughts. So if you reduce my anxiety by even 10%, those panicky thoughts get reduced as well, which as a result allows me to have a better existence, a better quality of life. So I'll take that 100%, and I'm very happy with that. But I had to ask for the Lyrica. The doctor didn't suggest medicine or tablets. I had to suggest it, and his first protocol was to put me on Seroquel. And I said, no, 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 no Seroquel. I hate Seroquel. I've taken it myself off script. I took it from addicts just to use it to knock me out from coke binges. I don't like it. So luckily he agreed, and we changed it to Lyrica. But yeah, very, very let down by the fact that I seen this particular woman for an hour and a half in 5 weeks. And the first time I met her, on this trip, she spent the first 20 minutes talking about what I'm going to do when I leave hospital. I'm going to go into schema therapy, which is behavioral therapy, kind of related to cognitive behavioral therapy. But the onus was on when I leave hospital, and it's very, very different to the experience that I wanted when I went in. I wanted to sit and talk and rehash all the information that we talked about before in greater detail, because we came so far along from the last time I was there. None of that happened, Some of the only really good things was psychotherapy groups, which I found brilliant. Like 6 people sit around, and 7 people, and you talk about really, really deep stuff that means so much to you, that's very vulnerable and very hard to talk about, and especially in a group setting, and you get some feedback on that. I was on once a week, and I wish it was on every single day, and it should be everybody in hospital should go to that, because if you take the risk and you talk about really hard stuff, and you get good feedback from the right kind of patients, it's brilliant, And I went to 3 of those, because only 3 of them were on, because she was away for 2 weeks. My therapist also ran the psychotherapy groups. So I had the psychotherapy groups, I had Lyrica, but I guess I had one more very important thing, and that was abstinence. Abstinence from drugs, drink, because I was using before I went into hospital. I wasn't drinking a lot, I wasn't taking a lot of Valium, but I was certainly taking a lot of cocaine, and it was out of control. So abstinence, I can't take that away from it. You know, it was a great time to be in a nice, safe environment where there was no temptation and no cravings, and luckily I feel that now. You know, I don't feel any cravings. um, so that was good as well to have that. You know, so that was kind of a little synopsis of my time in the hospital. Um, a lot of one other thing I guess which was good was the people I met, and that's something that you don't think about before you go to hospital. For the people that have never been there, it's the it's people, it's sufferers in there, just like in the support groups on Google, you know, it's people that understand, and you can talk to them in a certain way that you can't talk to the nurses or the doctors or the psychotherapists. You just have a special bond with these people, and you know, just before I made this video, I got off the phone to a patient that I was there with, and it was great to hear from her. And um, interestingly enough, she was someone that left that never wanted to be there, and she pretended everything. And you could see she's a lovely woman, but you could see that everything was an act. She wasn't there for herself. She was there for her daughter. And I'm glad to say that I was there for me, and I didn't try fool anybody, and I tried my best to make use of all the resources there. And for anyone that's ever thinking of going in or whatever, I suggest you do the same. Be open, be very honest, and take every resource that you can when you're there, because 5 weeks might sound like a long time, but it goes very quick. And you know, that woman, she wasted her time there, and she just told me on the phone she hated every single day there, apart from having fun with us. She hated every single day there, and I knew that. And you know, she shouldn't have bothered going in, because anyway, that's another video and that's another story. So that's my story, and thanks for watching, and with that I shall say goodbye. And here's my room.